This short video will look at lower thoracic manipulations, which can be very difficult. And particularly so if you're a small therapist with a big patient. However, they've got to be done. There are alternative ways of doing it. You can try a lumbar manipulation. There's no reason why you can't go through. But again, the longer the patient is, the more difficult these become to do. But you can do that. You've also got the prone techniques, which we've looked at in the past, and you could try those. You're more likely to be successful with those or lumbar manip than you are with the ones I'm going to show you with a big patient. Anyway, if your relative size are okay, then these work really quite well. The thing is, you've got to protect yourself with these. In one of these techniques, the patient's got their arms behind their head, and basically you've got to get back there and you've got to come into their forearms, like so. If their elbows stick into your ribs when you thrust, you're likely to damage a costochondral junction, and that doesn't heal very well at all, and you can end up with a lot of pain there for a very long time. So be careful. Make sure that in both cases, both techniques you look at, you are on top of their arms and their points of their elbows are pointing downwards away from your chest. Just make sure that you're not having the elbow sticking. That's about the most important thing you can do here. You've got to get your weight over the top of the segment you're manipulating, so you have to roll them up onto your hand. So you roll them onto your hand in the way you normally do, then bring them up and then get your weight right over it. You'll see it as we do this. And you can do flexion or extension, although they both look like flexion. With extension, you just roll it up until you can feel the pressure on your thenar from your body weight, and then if you side bend towards that side and thrust down, you'll manipulate that joint. To get flexion, you lift the pressure off of your thenar and then lay it down without extending them. So it's not a tipping movement, it's a lay down movement. You put it back on the thenar, side bend away from the thenar, thrust, and that will flex that joint. They're effective techniques, but they're not easy, as I say. So good luck with them, and talk to you soon. Bye-bye.
Inferior for flexion extension manipulations. Depending on the size of the patient, you're probably going to have to change the technique you're doing. I'll demonstrate a thenar thrust, but the principle's the same for knuckles, just change sides. So if I'm going to flex the left side, yeah. I'm going to flex the left side using the thenar. We'll come in, and this setup will be exactly the same. It's the arms that I may well have to change the way I do this, because I've got to get my weight down there, and I may not be able to get enough of that to occur. So I can do it one of two ways. I can use my body on her arms, or I can change the position of her arms completely. So we come in underneath. Now we're really quite low down now, there, and I'll bring her up this way. Basically side bend her to the right, lift her off, put her back down again, find the thenar and thrust down with my body. So again, come for a little bit higher, oh lower, sorry, there, and roll her, lift, underneath here, lift her up, lift her off, put her back down again and thrust down. Hands on the back of the neck, still using the thenar, lock your fingers, and roll there, lift onto your hand, and I'll bring her up this way. Now, what I'm going to do is I'm just going to bring her up until I feel, I don't want to bring it off the thenar. If I do, I'll extend her back onto it, but she stays extended. Side bend her to the right, and then thrust down through the arms. So again, up and over, bring her up, there, side bend her, thrust. Okay. Hands on the back of the neck, still using the thenar, lock your fingers, and roll there, lift onto your hand, and I'll bring her up this way. Now, what I'm going to do is I'm just going to bring her up until I feel, I don't want to bring it off the thenar. If I do, I'll extend her back onto it, but she stays extended. Side bend her to the right, and then thrust down through the arms. So again, up and over, bring her up, there, side bender,